What is the difference between pinnaplasty and earfold surgery? Now, I've got to be honest with you. I have reason to believe the last I heard the earfold has been taken off the market. So the reason I'm a bit cagey about it is because we don't offer earfold. We did way back in the day when we had Mark Lloyd, we offered it. So there's stuff on my website talking about earfold, but we no longer offer it because Mark's gone to London now, and so we don't offer it anymore. But I have a feeling that it is not available anymore, earfold. I've got a feeling. Nevertheless, I'll ask the question. So basically, pinnaplasty is changing the shape of the ear and is a well-established, long-established surgery which involves sculpting the cartilage of the ear. Broadly speaking, I would say there's two aspects to it. One is the concha, which is this bulb here, the conchal bulb. Sometimes the concha is too big. And the second is the antelocal fold, which is this fold here, where sometimes that fold is not very well formed and the ear is prominent. And sometimes it's a combination of the two, the lack of antelocal fold and deep concha. And pinnaplasty involves reshaping the cartilage. Sometimes we may or may not remove a bit of the conchal cartilage to try and set that back closer to your head, and reshaping this piece of the helix, the ear, to recreate that antelocal fold if there isn't one, or if there isn't a well-defined one. And we do that by making an incision at the back of the ear and remolding that cartilage and bringing it back. An ear fold is a relatively, I would say, although they'll probably hear that it's been out for 10 years, but it's a relatively, I guess, a new invention. It was invented by plastic surgeons. It's literally a metal clip that you can literally just clip on. You make an incision in the ear, small incision, and just put a little clip to recreate that antelocal fold. It's much less invasive, much less dissection, and it just puts a little clip. Now, the benefit of it is it's a much smaller operation. So that is the big benefit. Much smaller operation, much less scarring, much less downtime, much less complications associated with it. So that is obviously a good point about it. The bad point about it is that you're limited as what you can do, because you can only really shape the antelocal fold. It's quite expensive. The clips are quite expensive, and you have to. There's only certain surgeons who offer it, who can do it. I think you have to go on some kind of course which talks to you how to do it, and then you'll be able to offer the surgery. But as I say, I don't think it's available anymore. Having said all of that, so I think we're back to pinnaplasty, which is a long tried and tested, and you can always, any sort of ear can be addressed with a pinnaplasty, but you're only limited as to who you can address with an ear fold. So you could always have had a pinnaplasty, but an ear fold was an attractive proposition in the right group of patients. Although I have the reason to believe it is no longer out there.